So today's topic of discussion will be the duodenum. This is the anatomical position of the composite viscera of duodenum, pancreas and spleen. The details have already been described in the previous videos. Duodenum is the proximal dilated and fixed part of the small intestine. It is devoid of mesentery excepting in the proximal inch of the duodenum. It describes a C-shaped curve which encloses the head of pancreas and is subdivided into four parts. The first or the upper part is 5 centimeters, second or the vertical part is 8 to 10 centimeters, third or the horizontal part is 10 centimeter and fourth or ascending part is 2.5 centimeters. Coming to the first part, it extends from the pylorus to the superior duodenal flexure and is directed upwards, backwards and to the right. Length is 5 centimeters and on surface projection, however, the length is reduced to about 2.5 centimeters. That's it. We will not go into details of the relations or the arterial supply. This will be in the theoretical discussion. Into the second part of the duodenum. It begins at the superior duodenal flexure and as a continuation of the first part opposite L1 vertebral level. The second part passes almost vertically downwards in front of the hilum of right kidney, along the right side of the vertebral column, lodging in the paravertebral gutter and just within the right lateral plane. It ends at the inferior duodenal flexure opposite the lower border of L3 vertebra, where it bends to the left and is continuous with the third part of the duodenum. Now coming to the third part of duodenum. It is about 10 centimeters long, extends from the inferior duodenal flexure to the front of the aorta at the level of L3 vertebra. Okay. Fourth part of duodenum is about 2.5 centimeters long, extends from front of the aorta to the duodenojejunal flexure. This flexure is situated on the left side of L2 vertebra, about 1.25 centimeters below the transpyloric plane and 2.5 centimeters to the left of the median plane. The flexure is kept in position by the suspensory muscle of the duodenum, which is also known as the ligament of Treitz. Next, we will go into the description of the interior of the second part of the duodenum. The interior, if you look closely, presents the following features. First, circular folds, which are also known as plica circularis. Now these are permanent folds, mucous folds, thickly set in the duodenum. The second one is major duodenal papilla. It is a conical projection arising from the posterior-medial wall of the second part of the duodenum and is situated about 8 to 10 centimeters distal to the pylorus. Its summit presents a single orifice through which the bile duct and the pancreatic duct open. Sometimes the ducts open separately on the papilla. The third important feature in the interior of the second part of duodenum is the minor duodenal papilla. It is a small conical projection situated about 2 centimeters above and slightly ventral to the major papilla. Accessory pancreatic duct, when present, opens on its summit. The fourth point is plica semicircularis. It arches above the major papilla and resembles a monk's hood. The last, plica longitudinalis. It is a vertical fold extending downwards from the major papilla. Sometimes it is not very well marked in this specimen. Nevertheless, it can be seen in most of the fresh specimens. Sometimes another fold extends upwards from the major papilla and indicates the intra-abdominal part of the bile duct. So that's all about the anatomical positions of the duodenum.